What's up, everyone? Happy Thursday. Happy Thursday. What's up out? What's going on in the neighborhood? Dr. Tamika here. And I figured it's time to tell you a little bit about me. Some of you know who I am, some of you don't know who I am. And I've met a lot of new people recently from doing the various health fairs and going to different conferences. I just came back from this conference that was called Grow with Video. And wow, I tell you, how do you deliver your content so that people can understand what you do? What's up, my lovely children? Hello, what's up, twin mommy Janice? Thank you for being on board. Those of you who are here with me on Facebook, what's up, what's up? Welcome to the party. On today, I figured let me tell you a little bit about me, because one of the things I've recognized is some of you have been going through this health journey, and some of you have been on this journey with me, and you've learned some different tips along the way. And some of you are brand new, but you've heard the information, but maybe you really don't know me. So I'd figure, you know what? Since you've been hanging with me or you're new to me, why not I just reveal a little bit about myself? It's sort of like what's his name? Jay-Z. Allow me to introduce myself. My name is Dr. Tamika. And one of the things I enjoy so much about this type of medicine that I practice, which is called functional medicine. And what I realize is that many of you don't even know what functional medicine is. And functional medicine is this: how do you get to the root cause? Like, what is going on? Many of you have been to your doctors and you have asked questions. You've come in wanting to know about, I don't feel right. I feel a little bit off. You may have complained of having discomfort in your stomach. You may have had heartburn. You may have neck pain. You may have had recurrent yeast infections. You may have had problems with things that seem like off with your mental health. You may have had recurrent urinary tract infections, or your blood sugar may be off, your cholesterol, or maybe you don't have any of that and you're concerned about this runs in my family. And so I don't want to get this. So what do I need to do? So as we think about medicine, I want you to understand this. Yes, I am trained in the traditional sense. I'm a local person. I am Southern California raised. I was raised in Linwood, California. Linwood is right next door to Compton. If you don't know where Compton is, that movie Straight Outta Compton, I was like maybe a mile away from there, okay? So I was raised in Linwood, California. So when you talk about being a native of the inner city, I am truly from the inner city. So raised in Linwood, California, educated. I went to undergrad at USC. I went to medical school at USC. So I'm as native as it comes as it relates to being from California. Love to travel, right? I love to travel. So you know a little bit about my education, but let me tell you more about me. As a child, I had juvenile rheumatoid arthritis, which means I was in and out of the hospital constantly. I remember my mom telling me stories about being in the hospital and having an IV in my head because my veins were so fragile that they had an IV in my head. So I was in the hospital as a kid with all kinds of pains in my joints. I remember going to the hospital, being in elementary school and hating needles. To this day, when I get my blood drawn, I sort of cringe a little bit. So having my blood work drawn and being in and out of hospitals and staying in hospitals and staying overnight. So when it comes to understanding people who have experienced some things as it relates to their health, I get you. And many people, I just got asked yesterday, one of my son's friends had a 13-year-old birthday party. And so I was a swim party. So I was like, I'm going to be there. So I was just asked by this mom, so do you still have residual feelings from your juvenile rheumatoid arthritis? And what I can tell you is this: as a person who's had JRA, juvenile rheumatoid arthritis, what I can tell you is when I eat certain foods, in particular, those of you who have been hanging with me know I like candy, right? I love Swedish fish. So don't send any more Swedish fish. I appreciate it, but please don't send any more. When I eat stuff that's off, I can feel it in my joints. So I can have pain in my knee, or I'll feel a little achy. So I'm quite aware. My son Dawson will tell you that I'm like, okay, I'm giving up. I'm not going to have any more candy. And he'll say, Mom, don't eat the candy. So I know that I feel that. So when it comes to understanding or relating to those of you who may have experienced something or may be experiencing something with your health, I had JRA. And as an adult now, who's almost 50 years of age, I can tell you that one of the things I really, really think about is autoimmune conditions. And autoimmune conditions I really concern myself with at times because I had JRA. So rheumatoid arthritis is when autoimmune condition is when your body attacks itself. So when you think about functional medicine, and when I think about what I do, I can relate so well to trying to get to the root cause. Like, what's going on? Why is this happening? I don't want to keep pruning the branches on a tree. I want to get underneath the surface. I want to know, why is this happening to me? So when you have JRA and you've had experiences now almost 50 years of age, and you're like, okay, I got to pay attention to these things like functional medicine resonate with me. And the people who come into my practice, I just had a brand new person now from Orange County and dealing with other challenges in their health. And one of the things I can tell you is that when you start dealing with things or concerned about your health, or you want to be more proactive, topics like holistic, integrative, functional medicine come to, like, they resonate with you. You're trying to do something better. Many of you right now have either been on TikTok, you've been on Facebook, you've been in Whole Foods, Trader Joe's, you've been somewhere searching for like answers on how you can start to feel better. You've been looking for, okay, I'm not sleeping, I'm not resting, I'm having challenges, and you're going to all these different places. You in your own right are practicing a form of functional medicine. However, what you're doing is sometimes you're just medicating it with a supplement. So what functional medicine does is it gets to the root cause. It helps you understand, why is this happening to me? And if that sounds like something that resonates with you, give me a high five in the chat. Let me know, like, yeah, I want to get to the root cause. And so if you're ready to get to the root cause, that's what functional medicine is. It's root cause medicine. So when you stop and say, my health is my most valuable asset, you can spend $100, $200, $500, $700, $900, $1,000 on your car per month. But that car will come and go. Your body will not. You only get one life to live. This is your primary residence, your body. So when we think about functional medicine, that's what I want you to understand. I practice functional medicine. I get to the root cause. We start by looking at what else is going on. Yes, we have blood work. How many of you, by show of hands, have had their blood work drawn at least one time? You went to the lab and you had your blood drawn. And as a result of having your blood drawn, then you go and meet with your primary care doctor. And what happens in that setting? They tell you, they look at the labs and they may say these words, everything looks normal. And you're like, wait a minute, push pause. I don't feel so good. Something feels off, but the labs say they're normal. When we say this, what's up, Terry? When we talk about health, I want you to understand this, that when you look at lab work, you do not want to be normal. You want to be optimal. You want your labs optimized. You want to have the best things going on in your health for you. And as we think about these things, as we think about our health, as we start to get better, I need for you to hear me as a physician. I'm board certified in family medicine. Okay, so you got that, right? The next thing I want you to understand, when you think about functional medicine, when you think about your health, you want to think about root cause. And the last thing you need to be, and I need to be, is normal. Nobody that's paying attention now, who will watch later, who will come back and rewatch in the future, wants to be normal. You want to be optimal. You want your health to be optimal. So if you're not getting your health optimized, then I want to encourage you to stop and say, you know what? Ask some more questions of your doctor, saying, okay, I need a few more labs. I need you to dig a little bit deeper. And if that doctor's not going there with you, so perhaps you need to add another team member to your team. What I tell my clients in my practice is, yes, you need your primary care doctor. Yes, you need insurance. But when you're dealing with your health and you're trying to step outside the box and get beyond this state of being normal, you want to be optimal, then I encourage you, I invite you to work to add some more members to your team. I invite you to add a functional medicine doctor to your team. Doesn't have to be me, but I invite you to add some more people to your team. Because when we think about athletes, and I talk about athletes because both of my kids play sports. One plays ice hockey. Shout out to Miles. He plays ice hockey and lacrosse, which shout out to you doing really well this past weekend at the Toyota Center team tournament. Then I have my youngest son, Dawson, who plays lacrosse and soccer. So when you think about sports and you think about all these things, I want you to understand is that when you're dealing with your health, you want this body that you live in, you want it to be optimized. You want to get the labs. You don't want to be normal. You don't want to be a normal athlete. You don't want to be a normal mom. You don't want to be a normal dad. You want to be optimized. You want everything about you to be as optimal as possible. So when we're thinking about optimizing yourself, you need to think about adding people to your team. So when you think about sports, people like LeBron, people like Steph Curry, they have a team, right? They have the nutritionist, they have the massage therapist, they have the person that's cooking for them. They have a huge team working for them so they can be the best at their game. I'm not saying you need to spend millions and millions of dollars to get there, but you need to make sure you have your team on board. Do you have your primary care doctor? Do you have your functional medicine doctor? Do you have on your nutritionist. When you work with me, you automatically get a functional health nutritionist and a functional health coach who's a chef. Who is on your team? Who is going to help you be the best you that you can possibly be? Because as you get people on your team and as you start to think about functional medicine, you can start to dive down deep and you can start to look and see like, okay, what's going on? What's happening? Why is this happening? What can I do? Don't leave me with optimal. Don't leave me with normal. Sorry. I want to be optimal. Get optimized, people. Get optimized. Don't sit back and settle. Life is too short. Tomorrow's not promised to any of us. Get ready to be the best you that you can possibly be. Take simple steps. Start to look into functional medicine. Start to look into, okay, let me take a broader look. Let me put on a wider lens. Okay, I have diabetes. That's narrow. What else is going on? Diabetes, that's a blood sugar disease, right? No, it's a blood vessel disease. How can we go and protect my blood vessels? Well, I don't have diabetes. How do I end up so I don't have diabetes? How do I end up protecting my heart? How do I protect my brain? How do I get my digestive system to work better? Root cause. Root cause medicine is what I practice. When you think of Dr. Tamika, or some of you refer to me as Dr. Henry, but I realize Dr. Tamika resonates and they're like, okay, Dr. Henry, many people think I'm a man. Sorry, I'm not. But Dr. Tamika, I'm telling you today, on this Thursday, functional medicine is definitely a different approach. It allows you to get to the root cause, and that's what I practice. Now, granted, I do believe in supplements, but supplements should be supplemental to what you're doing. When we think about our health, when we think about what you're doing, when we think about the people you are impacting, whether it's in your home, whether it's at work, whether it's when you're out on the street, when you're walking, when you're out to dinner or out having a glass of wine, whatever that case may be, how can you impact other people to be the best version of themselves? When you start being the best version of you, you can help people be the best version of themselves. And we won't even get into some people, if they're hating on you, that means you have a lot of value in you that people you have to accept. And some people, you're doing something right when they start to hate on you, and that's okay. But as we think about this, as we think about our health, I want you to be encouraged, uplifted. Think about who's on your team. Who's on your team right now to help you be the best version of you that you possibly can? Do you have your primary care doctor? Do you have your functional medicine doctor? Do you have a nutritionist? Do you have somebody you're working out with? Do you have a therapist? Do you have your Bible study group? Who is on your team? I want you to know right now, as I work with those of you who are my clients right now paying attention, I want you to understand I'm here to be on your team. Do you often have a question here? Do you often have a difference of opinion with your patients' PCPs? I do. I do have a difference of opinions, but a lot of times, even if PCPs amongst PCPs have differences of opinions, and that's okay. At the end of the day, when you think of your health, you are the team captain. You are the person that's in control. You get to navigate what happens because you get to speak up. But sometimes we don't speak up because we don't know the right questions to ask. We don't know what to do. We just go and we read and we research and we listen to and we try, and it's trial and error. Many of you are practicing what I call the HAP method, which is hoping and praying that what you're doing is going to work. And I'm not against that method, but what I'm saying is when you are the team captain of your team, look at your team members. Perhaps we need to add some things. And as we think about differences of opinions, that's okay. Because at the end of the day, if it's going to help you become a better version of you, then you want people to really think about what can they be doing for your health. So I encourage people to speak with their primary care doctors. I encourage people to work with a functional medicine doctor. I encourage people to be the best version of themselves that they possibly can be. So on today, I encourage you to take a look into functional medicine. Why else should you listen to me? Yes, I have the certification from Family Medicine, board certified in that. Yes, I'm certified in functional medicine. Yes, I'm certified in bioidentical hormone replacement therapies. Yes, I've done all this training on obesity medicine. But at the end of the day, I care. I want you to care more about you than I care about you, because I can't push you into being the best version of you. I can only encourage you. I can tell you, I can lead you to where you need to be, but I can't make you actually do it. It's one thing to know, it's another thing to actually do. So yes, if you're out there, I see you around the ROQ. If you're out there practicing at the HAP method, hoping and praying, I'm okay with that, but sometimes you need to look to bring your team in to help you make sure you're on the right track. And if you're on the right track, then we'll continue to help you along the way. But if you're off course, then let's help you get back on course. And a lot of times, as I've said before, supplements are supposed to be supplemental. At the end of the day, I would say start with the basics, work on your cells. Vibrant cells is what we need. Once we get our cells right, work on getting your immune system right. As you get your immune system right, please deal with this stress. Stress less. That's so very important. As we think about these things, Stress less because we're getting hit left and right. Stress less. What's up, Nancy? As we move on and we think about sleep, deep sleep, we need this. So many of you are taking so many things. I had this one person tell me 4 different medications they were taking to sleep and they still weren't sleeping. We need to really, really help on this. As we move through life, there's going to be challenges. There's going to be ups and downs. There's going to be things. Your body changes. As your body changes, you just need to slow down and pay attention. Be the best proponent, be the advocate for you, and get your team together. Get your team and get your friends together who's going to help you be accountable and you help them be accountable. I hope that you're doing just small little steps, even if you're taking just a few millimeters of movement forward. That's progress. And if you take a step back, shake it off and move forward. So, as I go through this and I tell you about me, yes, I'm a local person from Southern California. Yes, I enjoy medicine, but more importantly, I love people. As I continue to learn from you and I learn some more today from another client, as I continue to learn from my clients, I get to learn from people as I was at the different no, one of my friends, oh my gosh, oh, there, or she works for herself, but I didn't know. Did you know that the strawberries from March organic strawberries were recalled? Like, I didn't even know that. The internet does some crazy things. Well, what can I say? The internet's doing some crazy look into functional medicine. Look, yeah, on you, not that you have to, that you happy graduation to all the graduates. Celebrate, congrats, keep doing you.